Hello everyone, welcome to Dr. Nguyen Wellness Channel. We would like to say hello and thank you for visiting our channel. On this channel, we are dedicated to bringing you newly information as often. We believe in providing you more information as we go. Our goal and commitment are to providing you with high-quality, enjoyable content that adds value to your life. Don't forget to hit that subscribe button and turn on notifications so you never miss out on our latest uploads. If you have a question, suggestion, we love hearing from our viewers. Feel free to leave a comment on any of our videos or reach out to us on social media. Again, thank you for choosing Dr. Nguyen Wellness Channel. We're thrilled to have you here, and we can't wait to share our passion with you. Get ready to dive in and explore all that Wellness Channel has to offer. Now let's dive into our latest video and start this incredible journey together. Sit back, relax, and enjoy the content, and remember, the best is yet to come. Hello everyone, let's go over some skin conditions. The pictures I used here for the reference purpose. If you feel the pictures are disturbing you, then just fast forward. Thank you for understanding, and hope everyone will learn something from this video. Let's start from minor condition to most complicated one. First condition of the skin called albinism, which the skin, hair, eyes, absence of pigmentation, either partial or completed, the absence of melanin. Melanin is a synthetic in your body that decides the shade of your skin, hair, and eyes. Many people with albinism have extremely fair skin, hair, and eyes. They are inclined to burn from the sun and skin disease. Melanin, likewise, is associated with optical nerve improvement, so you might have vision issues. Albinism isn't a sickness or disease. Albinism is a hereditary condition that individuals are brought into the world with. It's not infectious, and it can't be spread. Albinism can influence individuals of all races and every single ethnic gathering. In the U.S., around 1 in each 18,000 to 20,000 individuals has an albinism of some sort or another. In different regions of the planet, the proportion is 1 in each 3,000 individuals. What are the various sorts of albinism? There are a few unique kinds of albinism. Levels of pigmentation differ depending upon which sort of albinism you have. The various sorts of albinism include oculocutaneous albinism, or OCA, is the most well-known kind of albinism. Individuals with OCA have incredibly pale hair, skin, and eyes. There are 7 unique subtypes of OCA, brought about by transformations in one of 7 qualities, OCA1 to OCA7. Visual albinism. Visual albinism, or OA, is substantially less normal than OCA. Visual albinism influences just your eyes. Individuals with OA generally have blue eyes. Occasionally your irises, hued piece of your eyes, are exceptionally pale, so your eyes might seem red or pink. This is on the grounds that the veins inside your eyes appear through the irises. Your skin and hair tone are generally typical. Hermansky-Pudlak condition, Hermansky-Pudlak disorder, or HPS, is a kind of albinism that incorporates a type of OCA alongside blood problems, swelling issues, and lung, kidney, or gut illnesses. Chidiac-Higashi condition, Chidiac-Higashi disorder, is a kind of albinism that incorporates a type of OCA alongside invulnerable and neurological issues. What causes albinism? Albinism is brought about by transformations in unambiguous qualities that are liable for melanin creation. Is albinism hereditary? Indeed, albinism is passed down, acquired through families. Individuals are brought into the world with albinism when they acquire an albinism quality from their folks. In oculocutaneous albinism, the 2 guardians should convey an albinism quality for their youngster to be brought into the world with albinism. The kid has a 1 out of 4 possibility being brought into the world with albinism. Assuming only one parent has an albinism quality, the kid will not have oculocutaneous albinism. Yet, they'll have a half possibility being a transporter of the actual quality. Individuals with albinism might encounter the accompanying side effects: exceptionally fair skin, hair, and eyes, patches of missing skin color, crossed eyes, strabismus, quick eye developments, nystagmus, vision issues, light responsiveness, photophobia. What is the treatment for albinism? There is no remedy for albinism. You should deal with the condition by being careful about sun assurance. You can safeguard your skin, hair, and eyes by avoiding the sun, wearing shades, concealing with sun defensive attire, wearing caps, applying sunscreen consistently. Might albinism at any point be forestalled? Albinism is an acquired condition. Individuals with a family background of albinism ought to think about hereditary directing. What's the significance here? The word pale-skinned person comes from the Latin word albus, and that implies white. Individuals with albinism are here and there called pale-skinned people. An individual with albinism is the favored term. Is albinism a sickness? Albinism isn't a sickness. Albinism is a hereditary condition that individuals are brought into the world with. It's not infectious, and it can't be spread. What are the various kinds of albinism? There are a few distinct sorts of albinism. Levels of pigmentation differ contingent upon which sort of albinism you have. The various sorts of albinism include oculocutaneous albinism, oculocutaneous articulated oculocutaneous, albinism, or OCA, is the most well-known kind of albinism. Individuals with OCA have incredibly pale hair, skin, and eyes. There are 7 unique subtypes of OCA, brought about by transformations in one of 7 qualities, OCA 1 to OCA 7. Visual albinism. Visual albinism, or OA, is considerably less normal than OCA. Visual albinism influences just your eyes. Individuals with OA ordinarily have blue eyes. Here and there, your irises, hued piece of your eyes, are exceptionally pale, so your eyes might seem red or pink. This is on the grounds that the veins inside your eyes appear through the irises. Your skin and hair tone are typically ordinary. Hermansky-Pudlak condition, Hermansky-Pudlak disorder, or HPS, is a kind of albinism that incorporates a type of OCA alongside blood problems, swelling issues, and lung, kidney, or gut infections. Chidiac-Higashi disorder. Chidiac-Higashi condition is a kind of albinism that incorporates a type of OCA alongside resistant and neurological issues. What causes albinism? Albinism is brought about by transformations in unambiguous qualities that are liable for melanin creation. Is albinism hereditary? Indeed, albinism is passed down, acquired, through families. Individuals are brought into the world with albinism when they acquire an albinism quality from their folks. In oculocutaneous albinism, the 2 guardians should convey an albinism quality for their youngster to be brought into the world with albinism. The youngster has a 1 of every 4 possibility being brought into the world with albinism. In the event that only one parent has an albinism quality, the youngster will not have oculocutaneous albinism. In any case, they'll have a half possibility being a transporter of the actual quality. What are the side effects of albinism? Individuals with albinism might encounter the accompanying side effects: pale skin, hair and eyes, patches of missing skin color, crossed eyes, strabismus, quick eye movements, nystagmus, vision issues, light-sensitive, photophobia. Finding in tests. How is albinism analyzed? Your medical provider might do an actual test and inspect your skin, hair, and eyes. Notwithstanding, a hereditary test will give the most reliable outcomes and assist with figuring out which quality is transformed. This DNA test will assist with figuring out which sort of albinism you have. What is the treatment for albinism? There is no solution for albinism. You should deal with the condition by being careful about sun security. You can safeguard your skin, hair, and eyes by avoiding the sun, wearing shades, concealing with sun-defensive dress, wearing caps, applying sunscreen consistently. On the off chance that you have crossed eyes, strabismus, a specialist might have the option to address the issue with a medical procedure. Might albinism at any point be forestalled? Albinism is an acquired condition. Individuals with a family background of albinism ought to think about hereditary guiding. What complexities can happen due to albinism? Individuals with albinism might encounter any of the accompanying complexities. Skin issues. Because of their light-hued skin, individuals with albinism have an expanded gamble of burn from the sun. They additionally have an expanded gamble of skin disease. Vision issues. Individuals with albinism might be lawfully visually impaired, yet they can figure out how to utilize their vision over the long run. Certain individuals might have the option to address issues with astigmatism, farsightedness, and partial blindness with eyeglasses or contacts. Social issues. Individuals with albinism are at an expanded gamble of detachment because of the social disgrace behind the condition. Could individuals with albinism carry on with an ordinary life? Individuals with albinism can have ordinary, sound existences. Be that as it may, you ought to restrict how much time you spend outside because of sun openness. Certain individuals with albinism manage social separation because of the disgrace of the condition. You ought to converse with your family, companions, and specialists for help with your condition. Call and see your doctor if you see any skin change or physically discomfort. Next skin condition is vitiligo. What's going on here? Vitiligo is a sickness that causes loss of skin variety in patches. The stained regions as a rule get greater with time. The condition can influence the skin on any piece of the body. It can likewise influence hair and within the mouth, typically the shade of hair and still up in the air by melanin. Vitiligo happens when cells that produce melanin pass on or quit working. Vitiligo influences individuals of all skin types. However, it could be more perceptible in individuals with brown or dark skin. The condition isn't hazardous or infectious. It very well may be distressing or cause you to genuinely regret yourself. Treatment for vitiligo might reestablish variety to the impacted skin, yet it doesn't forestall proceeded with loss of skin tone or a repeat. Vitiligo signs include inconsistent loss of skin tone, which normally first shows up on the hands, face, and regions around body openings and the private parts, untimely brightening or turning gray of the hair on your scalp, eyelashes, eyebrows, or facial hair, loss of variety in the tissues that line within the mouth and nose, mucus films. Vitiligo can begin at whatever stage in life contingent upon the kind of vitiligo you have. It might influence virtually all skin surfaces. With this sort, called all-inclusive vitiligo, the staining influences practically all skin surfaces, many pieces of the body. With this most normal sort, called summed-up vitiligo, the stained fixes frequently progress in much the same way on relating body parts, evenly. Just a single side or part of the body. This sort, called segmental vitiligo, will in general happen at a more youthful age, progress for a little while, then stop. One or a couple of regions of the body. This type is called confined central vitiligo, the face and hands. With this sort, called acrofacial vitiligo, the impacted skin is on the face and hands and around body openings like the eyes, nose, and ears. Anticipating how this infection will progress is troublesome. Some of the time, the patches quit shaping without treatment. Much of the time, shade misfortune spreads, and in the end includes the vast majority of the skin. Incidentally, the skin gets its variety back. Causes vitiligo happens while shade-delivering cells, melanocytes, pass on or quit creating melanin, the shade that gives your skin, hair, and eyes tone. The elaborate patches of skin become lighter or white. It's hazy, precisely what makes these shade cells come up short or kick the bucket. It could be connected with an issue of the invulnerable framework, immune system condition, family ancestry, heredity, a trigger occasion, like pressure, extreme burn from the sun or skin injury, like contact with a synthetic risk factors. Anybody can foster vitiligo, yet you might be bound to foster it on the off chance that you have a family background of the condition, have regular direct contact with phenol-containing synthetic substances, like those tracked down in certain cleansers. Complexities. Individuals with vitiligo might be at expanded hazard of social or mental pain, sun-related burn eye issues, hearing misfortune. Everyone, let's move to the burn in human body. Most of the pictures are very tough to see, so I think we should know the percentage if burn in each part of the body without specific picture. Here's the rule of 9 we should keep in mind. If burn all head and neck equal 9%, if burn in each upper limb front and back, that equal 9%. If burn in each lower limb front and back, then it is equal 18%. If burn in front of body, the trunk, is equal 18%. If burn behind body, the trunk, is also equal 18%. And if burn in the palm of hand, that equal 1%. Next skin condition is the acne vulgare. This condition is usually occurring at puberty. This skin condition occurs when the hair follicles was clogged with the oil, skin cell, and/or bacteria. The acne vulgare can cause painful pimple, pus, nodule, blackhead at the end process. How this happened? When the hair follicle was plugged by the dead skin cells and the sebum, oily substance, then bacteria triggers caused inflammation of that hair follicle, then form pus. We may be able to differentiate the bacteria pimple with hormonal pimple by the area of the pimple occurs. Here are the common areas where bacteria pimple occurs: the forehead, chin, and nose, since these areas usually are oilier than others. On the other hand, the hormonal pimple is usually found in lower part of cheek and jawline. In teenager or young adults, hormonal pimple or acne often occur. But do not forget, in women, before menstruation or during ovulation also caused more acne. Another skin condition is the wart, or other name is the verruca. This condition is a skin infection by the human papillomavirus, HPV. There are more than 100 types of warts, and this condition is commonly in childhood. Different strains may cause warts in different parts of the body. Warts can be spread from one location on the body to another, or from person to person by contact with the wart. The main symptom is a fleshy, painless growth on the skin. Common areas affected include the hands, feet, and genitals. Next skin condition is the psoriasis. It is the common and chronic, long-lasting condition. The body immune system overactive causes skin cells to multiply quickly. A condition in which skin cells build up and form scales and itchy, dry patches. Triggers include infections, stress, and cold weather. Patches of skin become scaly and inflamed, most often occurs on the surface of the extensor part, such as elbows, knees, or the scalp, but other parts of the body can be affected as well. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. The next skin condition is the skin ulcer. An open sore or wound that develops on the skin ulcers can be caused by prolonged periods of poor blood flow to an area of the body. This can occur as a result of infection, immobility, or conditions affecting the blood vessels like diabetes. Symptoms include loss of the skin's outer layers, redness, and pain at the site of the ulcer. Now let's move to eczema. Eczema is the condition that causes dry and itchy patches of skin. It's a common condition that isn't contagious. Symptoms of eczema can flare up if you contact an irritant or an allergen. Some of the most common causes are a family history of eczema, environmental allergic reaction. Stress can trigger the condition. This is also an overactive immune system. The atopic dermatitis, the most common type of eczema, results from an overactive immune system that causes the skin barrier to become dry and itchy. Next is the skin tag. It is a harmless, small growths on the skin. This is a small stalk that attaches them to the skin, and it is often on the neck, upper chest, underarms, and eyelids. They may become irritated from rubbing against the cloths. To understand, this is a non-cancerous, so not to worry much. Another skin condition is the athlete's foot. This is a fungal infection that usually begins between the toes. Impetigo athlete's foot commonly occurs in people with sweating foot and using tight-fitting shoes. Symptoms include a scaly rash that usually causes itching, stinging, and burning. People with athlete's foot can have moist, raw skin between their toes. In severe cases of athlete's foot, you may develop fluid-filled blisters or open sores. The blisters often appear on the bottoms of your feet, but they may develop anywhere on your feet. Open sores often appear between your toes, but they may appear on the bottoms of your feet, so it may cause bad smell in some cases. The next condition of the skin we are going over today is the hives, or another name is the urticaria. This is a skin reaction that causes itchy, and the size from small spots to large blotches. Hives can be triggered by many situations and substances, including certain foods and medications. Angioedema can arise with hives or alone. Here are the hives' triggers. Some food, especially peanuts, eggs, nuts, and shellfish medications, such as antibiotics, especially penicillin and sulfa, aspirin and ibuprofen. Insect stings or bites. Physical stimuli such as pressure, cold, heat, exercise, or sun exposure. Latex, blood transfusions. Those are minor skin conditions. In next video, we will go over some common skin cancers. I hope you enjoy the video. Thank you for watching. I will see you in next video.